At the Community Health Center of Cape Cod, we're communicating with our patients about COVID-19 and how to stay safe and healthy during this epidemic. At this point in time, we are communicating via email messaging, our patient portal, and our website, as well as text messaging. So be on the lookout for information in regards to what you should do in the event that you think you may have the virus or you may have been exposed to the virus. The symptoms that we are concerned about include a significant fever, and in an adult we consider above 100.4 to be a significant fever, as well as a deep cough and shortness of breath. Those are the three primary symptoms, although there are other symptoms that can develop with this as well. What we would like patients to do is make sure that they are calling us before they are coming into the health center if they have these symptoms or they feel they have been exposed. Almost everyone who gets this virus will resolve it on their own without any kind of intervention other than symptomatic support. So rest, pushing fluids, using things like Tylenol and Advil to control fever and other symptoms. However, if there are significant symptoms like shortness of breath, that is something that may need to be treated more aggressively. And if you really feel that that is something that's a significant symptom for you, you should contact your provider and or go to the emergency room where supportive measures can be taken to help get through that part of the illness. The most important things to know to keep yourself healthy at this point in time are good hygiene. So as everyone has heard already, and I hope everyone practices on a daily basis anyway, is good hand washing techniques. So when you are before you eat a meal or after you've shaken hands with someone or been in any kind of a situation where you may have come into contact with things, you want to be washing your hands for 20 seconds with hot water and soap, or using one of the alcohol preparations that are good for hand hygiene. Trying to avoid touching your face with your hands is another way of trying to prevent the spread of this to yourself. Not an easy thing to do sometimes because it's kind of an unconscious thing that people tend to do. The other thing is when you do sneeze or cough, you should be doing that into your elbow, not into your hands, to try to prevent transmission that way. If you do develop symptoms and are not in any kind of distress, the recommendation at this point is to what they call self-quarantine, meaning stay at home, rest, push fluids, and take care of yourself in general. If you have any questions, please contact us at the health center and we can advise you on what the best course of action would be. As far as other measures to keep yourself healthy, wearing a mask in public, if you're otherwise healthy, is not necessary at this point in time. Those masks are really designed for people who are coughing or having symptoms and coming into a health center or potentially going to be exposing other people to symptoms. So really there's not considered much benefit to wearing a mask if you're going out in public and you're otherwise healthy. The patients that we do get more concerned about are patients who have some underlying medical illness. People who have lung disease or who have underlying heart disease or diabetes or are immunocompromised in some way may be at a higher risk for developing a more severe case of COVID-19. So for those patients, trying to avoid crowded places is a reasonable approach. Avoiding travel that's not absolutely necessary at this point in time is also being recommended. Certainly, the biggest thing that people can do to help themselves in this time is to get the flu vaccine if they have not already done so. We are seeing much more flu here at the health center than any COVID-19 at this point in time. So if you have not gotten your flu vaccine, it's not too late to do so. And certainly if there's any significant shortness of breath, you need to head directly to the emergency room and get assistance there.